Mechanism of drug resistance. So when we say resistance, we're talking about the lack of the effectiveness of the antibiotic. So we're going to talk about how the body becomes resistant to the drug. So the drug does not reach the target. So that's a common reason why. So it doesn't get to the site of action. So some antibiotics do not penetrate into the site of infection. Example of the areas that are hard to penetrate include bones, an abscess, the lungs. Sometimes it may be because the drug is not active. That may be influenced by the first pass effect, because as we know, whenever the medication goes through the first pass effect, it gets metabolized by the liver, there may not be enough active drugs in the system in order to apply its full effect. Now, sometimes the target is altered. In here, there's resistance to antibiotic therapy, basically when the antibiotics are prescribed for viruses, or sometimes when patient does not complete the full course of antibiotics, and then the organism can develop resistance to that said antibiotic, because then it has time to alter its wall in order to protect itself from the effect of antibiotics. How do we decrease this risk? It is very important for providers to appropriately prescribe antibiotic therapy when they truly need that medication. On the other hand, especially for us nurses, it is very important to know why we're administering it, right? And sometimes really it's good for us to know and identify, is this still applicable to our patients? And if it's not, it may be a good time to collaborate with the providers. And in addition, right, especially when we're discharging the patient, we have to give them appropriate patient education. One, to ensure that they complete that course of therapy. If the prescription or the order says 1 week, they need to make sure that they complete that 1 week therapy. And also, if for some reason they don't do that, it is very important to educate them not to save whatever's left over and use it for some other infection that they think can be treated with those leftover antibiotics. So patient education is very important in order to decrease the risk for drug resistance. There are some terms that we need to be familiar with, and we need to know the definitions. Bactericidal. Bactericidal are basically agents that kill bacteria. Examples of this include the beta-lactam antibiotics, vancomycins, and tetracyclines. Bacteriostatic, on the other hand, these are agents that don't actually kill the bacteria. Rather, they inhibit their growth. Example of this are the sulfonamides and macrolides. Now, sometimes you may hear broad and narrow spectrum coverage. So broad coverage is active against numerous or multiple gram-positive, gram-negative, and anaerobic organisms. Meanwhile, narrow spectrum coverage is only effective on a few organisms. So when it comes to this, culture and sensitivity will help aid for the treatment in order to target a specific organism and basically use the most appropriate antibiotic or antimicrobial agent for this specific infection. So general principles for all antimicrobial agents. So here we're just going to talk about general antibiotic use, indications, and so on. So indication, it just depends on the agent, right? Certain agents are more appropriate for very specific types of infection. Now, very common side effects of antimicrobial agents include gastrointestinal side effects, basically nausea, vomiting, diarrhea, stomach and abdominal cramping. So these are the most common side effects when it comes to antimicrobial agents in general. Some precautions, so antibiotics decrease in effectiveness of oral contraceptive agents. So this is a very important consideration when we're administering it to a female patient who is on contraceptives. And sometimes this is also an important patient education aspect. In addition, we need to make sure that we take in consideration the possibility or potential risk for causing a secondary or a superinfection. So that's always a risk when we're giving antimicrobial agents. Now, contraindications, sensitivity, and allergy to any drug in that same class, with exception to your cephalosporin and penicillin, because even though, let's say, your patient is not allergic to penicillin, but they have allergy to cephalosporin, there's a likelihood of being allergic to penicillin and vice versa. Nursing actions. These are the things that we have to do as nurses. So one, we need to ensure accurate allergy lists and their allergic reaction on continuum. So when we get a patient, it's not enough to just acknowledge, okay, they're allergic to penicillin, but if we can, and if they're able to provide us the information, right, what is the reaction that you're getting? What specific medication did you take? And how severe was the reaction? And how was it treated? Now, if somebody says that they had an anaphylactic shock after administration of that specific antibiotic, then we want to know what exactly is that antibiotic in order to prevent that from happening again. Now, we need to follow the WBC or white blood cell trend and possibly the symptoms and see if there's any response, if the patient is getting better, or if there's any possible side effects, right? Or if maybe this medication is not working for the patient. Follow and monitor, analyze culture, so CS, culture, and sensitivity results for appropriateness of antimicrobial agents. You may see that sometimes providers will start patients on broad spectrum antibiotic, just hopefully cover all the possible causes or causative organism for that specific infection until they get the culture and sensitivity. So we need to keep an eye on that culture and sensitivity, because ideally, once we get those results, we need to make sure that we put the patient on a narrower spectrum antibiotic in order to prevent superinfection or secondary infection.